morning. Thank you guys all for being here. We're going to be doing a press conference today regarding the recent overdoses in Lincoln. Captain Ryan Dale of the Narcotics Unit will speak first. Second will be Director Pat Lopez of the Lincoln-Lancaster County Health Department, followed by Topher Hansen of Centerpoint. And we also have available for questions Chief Jackson. We have LFR personnel, Chief Engler, and Pat Condon of the Lancaster County Attorney's Office. And with that, Captain Dale.
Good morning, everyone. Thank you for being here. We've really been trying to push this message out about the dangers of the illegal drugs, and especially the drugs that we're seeing right now in Lincoln. So we appreciate you being here and helping push this story out. Absolutely any help that you can provide us, we are extremely grateful for. In 2020, Lincoln experienced 133 overdoses. That was a 76% increase over the previous 5-year average. As concerning as that was, we've already surpassed that in 2020. We're sitting at 141 overdoses in 2021, and we still have over 4 months to go, of course. We have seen 50 overdoses in Lincoln in the past month. Over half of those required Narcan, sometimes multiple doses, in addition to CPR and other life-saving measures to revive the victims. Tragically, 4 of those victims did not survive. 1 more is expected to die. And even more tragically, 1 unborn baby that was in the 3rd trimester did not survive. Throughout the past couple of years, we've seen methamphetamine, heroin, and counterfeit oxycodone pills that all contain fentanyl. Numerous overdoses have occurred due to the users not knowing what is contained in those drugs. In the past few weeks, though, a trend that is new to Lincoln of fentanyl-laced cocaine has devastated our community. At least 26 of the overdoses in the past 3 weeks have been caused by this cocaine with fentanyl in it. One can never assume that any type of illegal drug does not contain fentanyl, and as little fentanyl as the size of 1 grain of salt can cause an overdose. The Lincoln-Lancaster County Narcotics Task Force has been working around the clock, investigating every single overdose. We have conducted interviews, analyzed evidence, served search warrants, and made arrests with the goal of stopping the overdoses as soon as possible. We investigate overdoses for 3 primary reasons. First, to hold the people providing those drugs to the victims accountable so they can't provide drugs to others, leading to more overdoses. Second, to search out and seize remaining drugs so those drugs cannot cause additional overdoses. And third, to provide information on resources to the victims so hopefully they don't continue to suffer from the effects of drugs and potentially overdose again. We are blessed with an incredible community full of wonderful people. We recognize that some of our citizens suffer from various addictions or have friends and families who do. There are many resources available to help. Recently, the health department started overdose prevention website that is an outstanding hub of resources. It can be found at lincoln.ne.gov, keyword overdose. It's time to band together and stop the suffering that too many of our citizens are facing. We encourage anyone with information regarding individuals distributing illegal drugs, especially drugs that have led to overdoses, to call the Lincoln Police Department at 402-441-6000, the Lincoln-Lancaster County Narcotics Task Force at 402-441-8181, or Crime Stoppers at 402-475-3600. Together, we can make our community a safer place. I'd like to now introduce the Director of the Lincoln-Lancaster County Health Department, Pat Lopez.
Thank you, Captain Dale. We've been working closely with the Lincoln Police Department and Lincoln Fire Department and other partners in the community. We are extremely concerned, and due to the seriousness of the situation, the health department will be issuing a health alert that will go out to the community. We are urging the public to know the signs of an overdose And if you know someone who is struggling with addiction, we want you to be prepared with life-saving rescue medication. Naloxone, also known by the brand name Narcan, reverses the effects of an opioid overdose. It is safe to use, and it's available to friends, family members, and loved ones of people struggling with addiction. Several pharmacies in our community provide this free. These include Hy-Vee at 50th and O, Kohl's Pharmacy at North 27, and USAFE Pharmacy in Waverly. It's important to mention that Nebraska state law exempts bystanders administering naloxone in good faith to save a life from any civil, personal, or criminal liability. For more information on overdose signs and symptoms, life-saving measures, and other resources, go to lincoln.ne.gov/OD. The health department is also leading a group that includes community members and more than 20 of our Lincoln organizations that are working together to reduce opioid and other addictions. The Opioid Overdose Prevention Coalition provides consumer and provider education and advocacy through collaborations in treatment, reducing stigma, and prevention education. Now I'd like to introduce Topher Hansen, the Chief Executive Officer of Centerpoint, who's also a lead member of the coalition.
Thank you, Pat. Centerpoint exists for a full continuum of care in this community, and treatment is certainly a part of that. So people wrestling with mental health and substance issues then can seek out outpatient or residential treatment at Centerpoint and other organizations in the city to help deal with some of the addiction issues they're wrestling with. But the other piece that we offer is a crisis response team and an outreach team. So the outreach team is out on the streets every day, working in downtown and throughout the city to help people who are in a homeless situation find resolution to that and get the care they need. The crisis response team has a 24/7 hotline at 475-6695. We also have walk-in availability at 13th and E Street during business hours that you can walk in and talk to a crisis counselor. And we do respond with Lincoln Police Department and in other situations as needed in the community to help people who are struggling. This is a crisis response team. What you should know is, as Pat mentioned, these teams carry Narcan with them at all times. You can carry Narcan with you at all times. You can go to these locations that Pat identified if you have a loved one who's struggling with this addiction. So to set yourself up so you don't have loss of life is important. The drug that we're dealing with here is a powerful drug, 50 to 100 times more than morphine. And what happens is people lace that with cocaine, which makes you go up, and the fentanyl makes you go down. Ages ago, they called that a speedball. Today, why people are lacing it with fentanyl, I don't know. But what I can tell you is just the grain of sand is too much. So when you think somebody's tossing you a tennis ball, turns out a wrecking ball is coming your way. So you need to protect your loved ones. You need to protect yourself. If you find yourself in that situation, obviously 911 and getting the emergency medical system employed is a critical factor because your life can be lost quickly. And for the loved ones and the family to be able to have conversation about this with the person who's struggling, to let them know what the lethality of this is and the danger is important and hopefully can save lives. We want to save lives. We don't want people dying from this mixture of drugs. And if you have that struggle and are sort of up against the wall and don't know what to do, call the crisis response team. We can come out and talk to you. We can get you connected to activities that will get you through this addiction issue through outpatient treatment, residential treatment, and other things. So use the resources available. More than Centerpoint, we have, all of our programs have Narcan available, but the Bridge Behavioral Health also has Narcan, as does Cedars. And so if you're in a situation, know what your resources are. Probably your fastest is going to be the emergency system, or if you have it in your possession because you know you have someone in your family who, or a loved one who is struggling with that addiction. With that, I'll open it to Chief Jackson. Did I just promote you?
No, that covers it for another week. Good morning. Just a quick overview. This is not a problem unique to Lincoln. The DEA has just recently, in partnership with the Omaha Police Department, Nebraska State Patrol, and ourselves, put out a flyer, again, cautioning citizens of Nebraska of the dangers of fentanyl and fentanyl-induced or laced drugs. This is a national issue that has come to light in the city of Lincoln. Overdoses are not new to Lincoln, Nebraska, but the severity and the numbers are. We have people dying from this, and while it may not impact you directly, secondarily through friends, through family, through co-workers, or whatever your association is, there's an impact to the city of Lincoln. As all of the speakers before me said, our goal here is the preservation of life, and we want to make sure that our citizens are safe, and we want to make sure we are alerting you to this threat, and that is our purpose today. There are protections for those that call us. The legislature and the governor in 2017 signed into law 28472, which allows for individuals that report overdoses to law enforcement or medical personnel to be exempt from many of the prosecutions available under the law. And we strongly suggest people call us at the earliest that they can, so that life can be saved and preserved. And that's our goal. And as we continue this, you can see we have a strong partnership through the health department, through the fire department, through the prosecution available through the Lancaster County Attorney's Office and the courts, as well as our service providers of Centerpoint and many others that are scattered across the community. We are one in trying to educate, inform, and help save individuals in our community that may be impacted by this fentanyl risk. So with that, I think we'll open up to any questions. So